on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Good afternoon. You mentioned, Chief Minister, that you thought some businesses may not be ready to open on Monday. And I'm thinking of care homes, for instance. They would definitely, private ones can do what they want. Have you got any more meat on the bones on what sort of businesses have thought they don't want to yet open?
Well, I was mainly talking about private sector businesses. They may well choose to. They've got their teams working from home, a large number, and they may decide that they're not going to bring everyone back on Monday, that they will do it in a phased way. And what we're saying is that's your choice. You know, we're saying that from Monday you can open up as normal, or the Manx normal as I call it, but we're not going to force you. That's your choice. So really it's just a recognition that for everyone they won't be able to open up 100% straight away. They can do it in a phased approach, and it's just a recognition of that.
And all government workers, will you all be going back to work?
Yeah, I would hope that the vast majority will be back on Monday. Obviously, there may well be a staggered approach too. We employ several thousand people across government, and if there's a need by the Chief Secretary and his team to maybe take a few days longer to open up certain areas, then that's an area that I really don't get involved in. That's their operational side of things, and that's for them to choose as private businesses what's the best way forward.
And secondly, for a lot of people, it's going to be a little bit more cautious, I think, this time opening up. I think there's a certain nervousness about going back to just completely hugging and shaking hands and that sort of thing. And the side effect of this, of course, is if you don't shake hands, you don't have too much contact with people, our rates of flu and colds will also decrease, which is probably a good thing, isn't it?
It could well be. I think it's been noticeable. There has been, I'll ask Dr. Ute to come in on this, probably I'd say the opposite, but I have been led to believe that we have seen a reduction in the number of winter flu, shall we say, and the increased hand hygiene that we're seeing as a community has helped with part of that. But it may be something for everyone to take on board, but maybe Dr. Ute and then David might like to comment on that further.
Thank you. Yes, that's true. The rates of flu are certainly very, very much lower than we would usually expect. We don't do a surveillance system for other respiratory illnesses. Flu does get measured in terms of hospital surveillance. And yes, we seem to have very much lower rates than we would normally get. So I think that is a side effect of the way we've all modified our behaviour, and in particular our improved hand and respiratory hygiene. So there's perhaps a lesson to take forward into the future with us there.
And has that reflected in mortality rates, less people dying?
We haven't been able to do the final death analysis because we don't get the death records in real time. Obviously, we do keep mortality under review, and we do an annual review of it, although we're a bit late on the current years because of pressure from COVID. But when those statistics do come through and they do get analysed, we will see that.
Okay, David, do you have anything to add to that?
Just a very quick one, because I think the Director of Public Health summed it up perfectly, but you did mention at the very start, Paul, that people may still be nervous come Monday, and I just want to emphasise again, it's okay for people to be nervous. It's perfectly natural, and just because we're going back to normal doesn't mean that people have to do things that they're uncomfortable with. If people still want to keep their distance, if they still wish personally to continue to isolate, or they want to wear masks in public, that is perfectly all right. It is natural that certain people will be nervous, and we should respect their decisions.